I'm about to show you the most important video report that I've done about the COVID-19 pandemic. In this report, I'm going to prove using 100% evidence from not only the CDC, but a state senator's own mouth, proving that they are purposefully inflating the COVID-19 death count. Why? Well, to spread so much fear and panic that the American people will submit to any and everything. And I'm going to prove it to you. But I'm going to ask you first to please share this video report with everyone. As you know, my channel is highly censored. So if you don't share it, it doesn't get put out there. Not only that, but please make sure you subscribe to my channel here on YouTube. And also get on over to restrictedrepublic.com because I am sharing so much more information on that channel because as you know, we're limited to certain things we can and can't say here on YouTube. And I'm already risking a lot by bringing you this report. Now that said, earlier this month and even last month, I have been showing you guys that the counts for pneumonia, the flu, heart attacks, and strokes have all magically decreased over the past couple of months. Why? Well, obviously, the death counts are going somewhere else. Not only that, but I also revealed to you that via a CDC report released to our doctors, told doctors to start counting COVID-19 deaths, whether they assumed it was caused to coronavirus or whether they had an actual test. Don't believe me? Let me show you the actual report. Now, this is a report that I've brought up before. Now, this is on NVSS, National Vital Statistics System on CDC.gov. And the question is asked at the very bottom, should COVID-19 be reported on death certificates only with a confirmed test? The answer, COVID-19 should be reported on the death certificate for all where the disease caused or is assumed to have caused or contributed to the death. Certifiers should include as much detail as possible based on their knowledge of the case, medical records, and lab testing, etc. If someone has died of other chronic conditions such as COPD or asthma that may have also contributed, these conditions can be reported on Section 2. In other words, your doctor can make a judgment call. If they suspect that COVID-19 could have been the reason for the death, even without a test, they can go ahead and add it to the death certificate, thereby adding it to the COVID-19 death count. Not enough evidence for you? How about this? How about a Minnesota state senator who is also a doctor that has come out and stated that they told him to inflate the numbers via a report? Take a listen.
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia after, and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor.
Want to see the report he was actually referring to? Well, it's another report from NVSS. Take a look at this report, NVSS Vital Statistic Reporting Guidance for COVID-19. And it states this on page 2. In cases where a definite diagnosis of COVID-19 cannot be made, but is suspected or likely, e.g. the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. In these instances, certifiers should use their best clinical judgment in determining if COVID-19 infection was likely. However, please note that testing for COVID should be conducted whenever possible. In other words, if COVID-19 is probable or suspected or assumed, then go ahead and add it to the death count. But that's not all this report does. It actually gives a couple examples. Now, for sake of time, I'm going to show you just the example he referenced. Take a look here on the screen. And this one says, scenario, an 86-year-old female passed away at her home. Her husband reported that she was non-ambulatory after suffering a stroke 3 years ago. He stated that 5 days prior, she developed a high fever and severe cough after being exposed to an ill family member who subsequently was diagnosed with COVID. Despite his urging, she refused to go to the hospital, even when her breathing became more laborious and temperature escalated. She was unresponsive that morning and her husband phoned the emergency medical services. Upon EMS arrival, the patient was pulseless. Her husband stated that he and his wife had advanced directives that she was not to be resuscitated. After consulting with the medical command, she was pronounced dead and the coroner was notified. Here's the comment. Although no testing was done, the coroner determined that the likely UCOD was COVID-19, given the patient's symptoms and exposure to an infected individual. Therefore, COVID-19 was reported on the lowest line used in Part 1. Her ischemic stroke was considered a factor that contributed to her death, but not part of the direct cause sequence in Part 1. Here's the thing. They are telling doctors to make a judgment call about COVID-19, but here's the catch. They do not do it in any other circumstances. So, for example, if somebody has AIDS, right? They have AIDS and they happen to catch pneumonia while they have AIDS. Their death is not due to pneumonia. Their death is due to AIDS, right? If somebody has cancer, has chemo, and say they catch the chicken pox and die of the chicken pox, right? Or whatever, or dengue fever, or they die of pneumonia, or they die of the flu, that does not go down as a flu or dengue fever death. It goes down as a cancer death. Why is it different with COVID-19? And why are we making judgment calls when doctors are supposed to be basing stuff off facts? You see, listen to what the state senator and doctor had to say about how he classifies things. Take a listen.
And doctor, in that same CDC guidance sheet on COVID-19, it references the fact that basically this is a judgment call.
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate, and I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia. And in the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death. And yet that's what we're being asked to do here.
Wow. They don't do this with the flu. They don't inflate the numbers with other viruses, just COVID-19. Why would they want to do that? Well, good question. And this senator gives the answer in another interview. Take a listen.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people. And I worry about that. I worry that sometimes we're so darn interested in just jazzing up the fear factor.
Fear. Fear can control people. Is it any wonder that fear has gripped the United States of America and we're letting this rule everything? Why would we do that? We get in the car every single day knowing what happens. But yet, we're going to allow fear to control us. Now you see why this is one of the most important video reports that I've done. That's not all. It gets even worse. Want to know something else? Hospitals and doctors' offices are all in pain right now. I've already done reports that they're laying off doctors, ER nurses, staff members, nurses right now due to the lockdown. Not due to COVID-19. They're due to the lockdown, due to the fact that people can't get surgeries. Hospitals are having to lay people off and are desperate for money right now because they're suffering. When they finally let these lockdowns off, some of your doctors aren't even going to be in office anymore. They're going to be shut down. And then we're going to have a mass surge in the hospitals everywhere once they stop these lockdowns. Not because of COVID, but because of what our government did with these lockdowns, right? But nonetheless, I digress. How does the hospitals right now need to get money? Well, if they classify something as a COVID death, they get money. Take a listen.
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do.
13,000 doctors for one COVID diagnosis, and even more, 39,000 if you can put them on a ventilator. There's your proof. There's your evidence. Please share it with everybody you know. That said, please don't forget to check out my partner at noblegoldinvestments.com. If you've not converted your 401k or you haven't checked your 401k, do it now because that money is dwindling. You want to do something. Put it in something backed by gold, silver, precious metals. There are now 16.6 million people out of a job. Make sure you give them a call today and let them know Lisa Haven sent you. Anyhow, thanks again for tuning in. I'm Lisa Haven, signing out.